from my perspective, in the ER, burnout rates are pretty high.
I mean, it's not uncommon that you could go work in a fast food restaurant and probably make more money per hour than you could as a paramedic riding on a 911 ambulance.
You are listening to EMS with your hosts, Erik Axene and Matt Ball.
Ouch. You okay there, Sunshine?
Yeah, I'm okay. I think I'll live.
You gonna live? You gonna make it?
I think just barely.
It's kind of part of our topic today. Are you gonna make it? Talking about EMS burnout.
Burnout.
Not even really EMS. I think we should talk about like healthcare as a whole burnout.
Well, before we get started, what are the top 5 based on a 2023 study, which I will not cite right here because I can't remember, but it doesn't really matter. But the study showed the top 5. What were they?
Top 5 burnouts, career burnouts.
Yeah.
Oh, I would think like first responders got to be in there.
Number 2.
Number 2. Since COVID, I would say maybe nurses.
Yep, that's doctors and nurses. Healthcare workers were number 1.
Yep,
good.
Okay. Police officers.
They were included in emergency medical services. Yeah.
They were included in emergency medical services.
Emergency services.
Just first.
Is what they call
Gotcha.
it. Yeah, first responders.
So that's the big 3. Let's see what else. Gosh, I have no idea.
Teachers was number 3.
Yeah, that makes sense. Teachers, yeah, I could see that. Totally see that. Those service-related.
And I can't remember number 4 off the top of my
Wasn't
head.
it construction workers?
Construction workers. That's right. And then accountants.
That's right.
Accountants.
Yep. Accountants.
Interesting.
Okay.
But we're talking
probably around April 15th. They're all.
Yeah, I know.
I'm over it.
But I think I could speak from the healthcare perspective. You can speak from pre-hospital. I think we could both speak to both.
Yeah.
But this is a real issue.
Oh yeah, especially since 2020.
Oh yeah.
Yep.
And I think this is something people are trying to figure out as far as staffing goes, right? Because I know from my perspective in the ER, burnout rates are pretty high compared to other medical, professions or specialties.
Yep.
And we used to be pretty competitive.
Yeah.
Last year, I think I read that we had 500 unmatched spots in residencies.
Oh wow.
Which means it's not competitive at all.
How much did that happen when you went through medical school?
That never happened.
It never happened. Yeah.
No, never happened.
That was like when I hired on in the fire department. Oh, super competitive.
Yeah.
I mean, every test I went to, there was at least 200 to 300 people there taking that exam. One test I took, it was on the floor of a college basketball stadium. I bet there was 1,500 people there taking the test. It's a civil service department, but it was super competitive. You had to be certified.
How many spots?
Oh, then they were probably hiring 1, 2 maybe. There's 1,500 people showed up. Again, civil service means like no requirements. But yeah, I mean, the departments I was going to were everywhere in the area, you had to be a minimum of a firefighter EMT. And it was paramedic preferred because they had few jobs and everybody wanted them.
Yeah.
Today, I mean, in my department specifically, we've been hiring uncertified people for the last several years and paying them as they go through school.
Where I was testing, they told me, if you want to get a job, become a paramedic.
Oh, really?
Yeah, you needed the training.
Yeah. Interesting.
To be competitive.
Yeah, right. So yeah, it's definitely the landscape has definitely changed in that environment, and again, COVID I think had a huge role in that.
Yeah.
I know, and you can speak to the census numbers at the hospital that you worked at. I mean, it's almost doubled. What used to be a busy day is now every day.
Right.
Right.
That's right. Now this area is growing quite fast.
That's another factor.
But COVID really did a doozy.
Yeah.
And it really hurt, I think, at least from my perspective, it hurt a lot of the perspectives, I think, of healthcare workers, in my opinion, and burnout. I think people realized how burned out they were.
Yeah.
And then they were asked to push it to a whole new level.
Yeah.
And it's just enough is enough.
Yep. Yeah.
And so people are leaving the profession.
I know with pre-hospital providers, especially our private ambulance folks, the compensation, like teachers. I mean, it is criminal, in my opinion, what teachers are paid.
Yeah.
They should be paid so much more money. It's criminal. And same with, as a fire department employee, my compensation is, I'm very happy with what I make. I'm very blessed, lucky to work in an area where firefighters for the cities I work in are compensated fairly well. But private ambulance, I mean, I know guys that are flight medics, and these are smart people, not just guys. These are smart paramedics, and I mean, if I have something happen to me, I would pick them over most doctors I know because they know their stuff, and what they get paid is ridiculous. I mean, it's not uncommon that you could go work in a fast food restaurant and probably make more money per hour than you could as a paramedic riding on a 911 ambulance.
I was at a local chain establishment, and they had some postings for how much people would make at certain jobs at this particular establishment, and it was really impressive how much they could make. Now, I mean, I'm all for climbing the ladder and trying to improve your standing, and competing, right? That's good. Yeah. But the reality is in our society, the fact that you can make more flipping patties than saving lives, I mean, there's something wrong there.
That's kind of crazy.
And that's going to contribute to some burnout. Compensation's a big deal.
Absolutely. Yeah. I mean, when you're thinking about when you increase the call volume and the pay is not reflected, if your call volume has doubled and your pay hasn't doubled, like, I'm not saying it's all about money, but when people want, and I think everybody, when they dial 911, they expect competence showing up at their house, right? And when you got people showing up that are making $15 an hour, and literally they could go flip burgers for more money than that in some places. I mean, it's kind of that old adage, you get what you pay for. I mean, it's really true. You really get what you pay for. And the call volume has increased, the equipment, especially, again, in the private ambulance, the private EMS arena. You know, their equipment isn't always up to snuff. Their working conditions aren't always that great.
You're right.
And they're just not getting compensated for the level of stress that they have to deal with. It's crazy.
No, they're dealing with some tough social situations. Things that they're not taught in school.
No.
Put in high liability, risky situations. All for very, very relatively low compensation. Pay. That's it's a shame. Here's and I totally agree with everything you're saying. You know, one of the things that I've done, I know when I remember I had a job that needed to be done, and I had a friend of mine needed to make some extra money, and I was actually I was teaching at the time, and this student was on summer break, and he needed a job.
Need some cash.
Yeah. And so I thought it'd be a good opportunity, little sweat work outside, doing stuff that, my sorry carcass was getting kind of old to do.
Yeah.
But anyway, the work was, it wasn't too complicated, right? And I asked how much he wanted, or he thought he should be paid. I mean, I didn't know.
Right.
And
fair question.
Yeah, but in my mind, I wanted him to give me a number.
Right.
And we've talked about things like this before, and so I remember I gave him a bigger number than he said, and I'll never forget. And it was so cool is that he had seen something else that was broken and fixed those things. It wasn't even part of the job, and then he did some other stuff that he noticed that needed to be done. And the reason I tell that is because when you're properly compensated, it's not that I was trying to manipulate him to do extra work or to find cheap labor or something like that. I wanted to fairly compensate him, and when somebody feels fairly compensated, they do a better job, right?
They go above and beyond.
Yeah. And so with our patient community, it seems to me that we should be paying people appropriately if we're going to expect this level of performance, especially when it comes to saving lives, right? And I know that there's a lot of money in the healthcare industry. Biggest GDP in the country. We spend more on that than defense. Trillions. I think was it 17 trillion?
I think that's what you were saying the other day.
Or maybe it's 17% of GDP. Anyway, a lot of money, trillions of dollars. And we as a country value human life, but it's sad to see the pre-hospital environment where people are really grossly underpaid.
Or in hospital. I mean, like you say, nurses. I mean, nurse compensation is pretty good, but so many hospitals, again, since COVID, they've dropped off techs, they've dropped off environmental staff, and they've put all that load on the nurses. Oh, well, they look, they're nickel and diming it like, if I save $1 here on this person, that equates to millions of dollars for the hospital, right? Mm-hmm. And patient ratios, that became a huge issue during COVID. Where, you were on a floor and your patient ratio was 4 to 1 or 5 to 1 on a med-surg floor. Right. All of a sudden it was 10 to 1. Or you're in an ER and there's no way, if you're in a relatively busy ER and you're getting more than 3 or 4 patients. And these nurses were being asked to 5, 6, 7, 8. That's insane. Yeah. And like you said, patient care is going to suffer. I think the other side of it too, and this is kind of a discussion for like the citizens, is I don't think they realize the abuse of 911 and how many people are abuse the 911 system and just call. When I'm talking to friends and occasionally people will ask like, what's the craziest thing or whatever, and I always tell them like some of the dumb stuff that we get called out to, and they're like, you got to be kidding me, somebody called 911 for that? I'm like, oh, every day. Yeah. Every single day they do it. Yeah. And people, like the average person, is blown away by that. Mm-hmm. Blown away that somebody would call 911 for whatever reason, fill in the blank. Yeah. And it happens every single day.
I'm a 25-year-old man, and I have lots of ladders, and can you please change my smoke detector?
Yeah, that's another one. That is another one.
Give me an example. What's the worst?
Oh, people calling at 2 a.m. for a headache. Yeah. Calling 911 for a headache. Yeah. And
it better be a thunderclap headache.
Oh,
the kind of headache.
Oh, no. And the biggest thing is then you pull into the house, right? Yeah. You pull up to the house, and there's 3 cars in the driveway, and their spouse is there. They've got 2 adult kids that could have. It's like,
and they refuse anyway.
Well, no. A lot of it is they have it in their mind that we called you because we knew if the ambulance took us, we'd get a room right away. We won't have to wait. Well, I can tell you, brother, sister, that ain't happening anymore. Prior to COVID,
send them to triage.
Oh, prior to COVID, I never one time I very rarely put a patient in triage to begin with, right? Since COVID, now it's just a regular thing,
Wall times.
But I've never put a patient in triage that I had started an IV on. And it wasn't that long ago, we had a patient that we had actually given pain medicine to. A low dose, nothing. She wasn't knocked out, or the patient wasn't knocked out at all. But we gave her a low dose of pain for whatever the case was. And they're like, we literally have no beds. They had no beds in the ER, nothing available. They have to go in the waiting room. So, people need to understand that, you call 911, that ain't a free ride to a hospital room. If you're low acuity and they're busy and everybody's busy, you're going to the waiting room.
And when you get called for stuff like that, source of burnout, frustration, right? It's
2 in the morning. Cumulative. How long has this stomach pain been going on? Oh, I've had it for 3 days. It's like, well, then why didn't you call? Why didn't you go yourself, So that, it gets frustrating. The people that call, again, for people that are watching that maybe aren't in this field, that we have, there's different terms. Frequent flyers or high volume users. People that call 911 on a regular basis. And sometimes a lot of it is invalids, and a lot of it you feel bad for the people because they don't have any other resources, right? Right. And at the end of the day, there's a quote, and people are going to laugh at me that are in the fire service, right, for saying this. But there's a quote, I don't remember the exact quote, but there's a line in the movie Backdraft with Kurt Russell. The Chicago Fire Department fireman movie back in the day, right? It's a cool movie, right? Whatever. Every fireman's watched it. They love it. I don't care what they say. But there's a part where he's talking to his ex-wife, and he was talking about how people just call 911 and the fire department just shows up. Like when they don't know who else to send, they call the fire department. The fire department's going to show up. Sometimes the police can be like, no, we're not going to that. The fire department we never say that. We get called out to things that would just make you shake your head sometimes, and we're going to show up and we're going to figure it out. Well, that can lead to burnout. When you're going on dumb call after dumb call.
In the middle of the night, lack of sleep.
Yep. It is a real issue that people in the country need to understand, is that we're really here. We should be here for life-threatening emergencies.
And there's also the moral trauma of doing what you're trained to do. there's a lot of really
the other side.
horrific stuff that most people in the population don't get to see that can contribute to burnout as well.
Yeah.
I think you told me that the average person sees how many life-threatening sorts of events in their life?
Three.
And then for
first
responders, how
hundreds.
many? It wasn't
Hundreds.
like 900 or something like
Yeah,
that.
it was like almost 1,000.
Yeah.
In their lifetime. So
Yeah,
the average citizen experiences about 3 traumatic, they see a bad car wreck or something. About 3 of those. And a first responder sees, almost
the
1,000.
fact that the burnout rates are so high, I mean, it all makes sense.
Yeah, the lack of sleep, which we've talked about that on our podcast, that is,
Huge.
to your health is huge.
Yeah.
Because you're working these crazy shifts, your diet suffers, right? All these things suffer. Your health suffers. You get addicted to tobacco, nicotine, alcohol. Unfortunately, that happens a lot as a coping mechanism. And all those things work against mental health and all those things that we've talked about in the past. That all leads to burnout, right?
Yeah.
And so how do we fix it? What is the fix?
Yeah,
Doctor?
Yeah.
It's a simple answer.
Yeah, watch our Thrive podcasts.
That's part of it, for sure. We have to be able to take care of ourselves, right? We've talked about that before, that BSI seen safe, right? If we are not protected and healthy, it's going to be hard for us to protect the community.
We have to be disciplined in our lives to maintain balance, I think. It's easy to say. It's hard when you've purchased the boats and the cars and the houses, and then you're stuck and you need to keep the income high, right?
Yeah.
But I think that if we can find balance in all these things and in all the different dimensions of health, I think, and we talked about vitality, right? With mental health. I think maintaining, mental health is a big part of it. I think maintaining it, relationships. I mean, if you're too busy to maintain your relationships with family and friends, it's not going to end well for you eventually.
Yeah.
Right? Yep. I mean, that is something
and it needs to be even outside of work, for instance.
Right.
Yeah,
absolutely.
It's got to be something outside of that.
Yeah. But I think there's a lot of different strategies that one could employ to try to prevent burnout, and one of them is, as tempting as it might be to work overtime to make more money, live at a level that you can afford, right?
Champagne on a beer budget.
Yeah, right. Yeah. That's good. I like that.
Yeah.
I think the same thing's true in any job. I remember my first job as a teacher. I felt like, I wasn't making very much money. This is a long time ago. But I felt like I had really arrived. My first real job.
Oh, yeah.
Right. Paying taxes, and really felt like I had a career now, right? I was 21 at the time. And
a big boy job, as we call it.
And the next year I made a little bit more.
Yeah.
The salary kept going up with more experience.
Yeah.
And my level of spending went up too.
Of course.
And that's classic too as physicians. We'll spend and spend and spend.
Yeah.
And money will not make you happy.
No.
As sooner you realize that, I think that's a big factor as well.
I think a lot of people need to remember why they got into EMS.
Yeah, what's your why?
Yeah, what's your why? Why did you become a nurse? Why did you become a firefighter, a paramedic, or whatever? It's a greater, something big greater than yourself, right? Higher calling. And like you said, I know a lot of millionaires that are miserable.
Oh.
Right?
Yeah.
They work their tails off, and, they look all, they're driving the fancy car, living in the big house. That doesn't always equate to, doesn't always equate to happiness.
What's the cause?
What's the cause of the cause? The because of the cause? Our blooper reel.
I was reading another article about another remedy for burnout is giving back by teaching.
Yeah.
You can,
really?
and this is more of a physician, I think, study looking at physician burnout.
Yeah.
But by giving back and educating, whether it's maybe in the pre-hospital environment or to other physicians or who knows, the community.
Yeah.
By giving your time in education is one of the most effective ways to prevent burnout.
Really?
In this study that I read.
Yeah. Interesting.
But I think, one of I really believe this, if you're feeling negative or you're complaining about your job or you're, whatever it might be, finding a way to give back. Because we have a tendency when we get stressed out or to want to suck, and like give me, right?
Yes.
Give me, right?
Yes.
It's a survival mechanism.
Sure.
But there's actually value in the midst of that those negative feelings is to try to reach out.
Yeah.
And I think those things. This is another strategy too that can help.
Yeah.
But I know for me as a physician, the teaching I would do in the fire station was recharging.
Yeah.
I really like that.
Oh, for
Do you
sure.
feel that way as an
100%.
FTO teaching a new
Yep.
paramedic?
Oh yeah, especially you get that new kid in there,
Yeah.
and you kind of see that energy and that excitement that they have to come, and they want to run on any call. The tones go off for a nursing home call, and they're running to the ambulance, and you're like, "Oh my God, we've been here 10 times today," and they're still excited. So yeah, that reinvigorates you for sure.
Oh,
I think remembering back, why did you, get into this field is always important.
Why did you get into the field? We've talked about what you've done and lots of adventures and things.
Yeah.
But in one sentence, what would you say is the reason, your why?
Well, I guess unknowingly, I always kind of had it maybe in my subconscious that I want to do some kind of a job of service, right? I think I always kind of knew that, whatever that looked like. And I really accidentally got into the fire service. We've talked about this before. And I just saw it as an opportunity to, and a lot of people say this, and it's cliche, why'd you get, I want to help people.
Yeah.
And the fire service is one of those jobs that literally that is your job.
It's your commodity.
That is
Helping
100%.
people. Yeah.
That is 100% what your job is you are here to help people. And so if you keep that in the proper perspective and understand that, hey, look, I've chosen this life, right? I'm not going to drive a $100,000 car. I'm not going to live in a $2 million. I'm not going to have that, right? Unless I marry rich or whatever, or win the lottery or something crazy. Right. But more than likely, I'm not going to have those things, right? But I'm going to be rich in the things that matter to me. Yeah. I'm going to be rich in the fact that when I wake up and go to work every day, I love what I'm doing. Yep. I'm going to be rich in the fact that I know what I'm doing is making a difference in my community, making a difference in the world, right? Yep. And that hopefully will give you your sense of worth instead of money, right? Good. Because like you said, there's lots of people that have all kinds of stuff, money, things, and it doesn't fulfill them, right? And so, it's...
There was a period of my career I kind of sold my soul because I wanted to make a lot of money. Yeah. And so, normally an ER doctor works this much. I was working. I was working so much. Yeah. And, anytime anybody needed help at another hospital, I was saying yes.
And what sacrificed? Family and everything else.
Yeah, but I was getting so burned out, and the money not worth it. Yeah. The money's not going to make you happy. Yeah, no. I think they did a study what is the perfect amount of money in our society to make. Oh, really?
The perfect amount of money.
Yeah, and now this is older. Study. This is older, but they studied it though. They were trying to look at based on subjective happiness of people. Okay. And obviously it's not a controlled study of right. But they were actually surveying people trying to figure out, and they had different metrics of ways to measure happiness.
Yeah, where are you living?
And then they took the salaries of these people, and based on the data, the happiest people weren't the most money. Rich. You'd think maybe that as you made more money,
your happiness would increase.
It would just go up. Right. That wasn't the case. Actually, it showed a bell-shaped curve. It went up and then back down again.
Really? So there was
and right there, there's that sweet spot. Yeah. And you don't need to make a ton of money. Yeah. To increase your happiness. I really, if you're not happy today with what you're making, you're probably not going to be happy making more. And money's not going to make you happy.
100% correct. Yeah. Yeah, because you're probably going to then have to go sell your soul, so to speak, do something you don't want to do in order to make that much money. And I know a lot of guys that have big jobs and they make big money and they work all the time. They hustle and work. And you know what? For some people, that is happiness, right? Maybe that's again, everybody's kind of on their own journey, right? Maybe that works for them and their family, right? That God bless them. Go do your thing, right? But I think work-life balance is a huge part.
A huge part of this.
And especially doctors, I know a lot of doctors that have said if I could go back, I don't know if I'd do it all over again because it's so hard on your family, depending on what kind of physician you are. So hard on your family, so hard to have a work-life balance.
If I would have known how hard it was going to be, I wouldn't have done it.
Really?
As a 21-year-old?
Yeah.
If I
would you
really
have stayed a teacher,
understood?
you think?
Yeah, maybe. I don't know. I like to do lots of things.
Yeah.
I don't know, but I'll tell you one thing though is that that there's a lot of sacrifice.
Yeah.
A lot of gave away a decade of my life, and
Yeah. Oh yeah.
and then when you're done, you're $400,000 in debt.
Yeah.
And then you're working in a job that's high stress, and
it's not always everybody sees the upside of being a physician.
it's not the money. You make good money, but it doesn't. The money isn't going to make you happy.
Yeah.
You be able to provide for your family. There are definitely benefits, but you're not gonna. It's not going to make you happy. There's so many other things that come along with that.
Mm-hmm.
It's not.
Now,
it's not worth it.
I would have 100% still go into the fire service. 100%. I think most guys in the fire service would probably. I think most guys love their job.
Yeah.
Again, we very lucky. You know, the compensation for firefighters has improved.
Yeah.
People, so I'm super happy with where I'm at. With Jerry Wells, who we had on our podcast.
Love
One
that
of the
guy.
things.
What a great guy.
Fantastic dude. He told me a long time ago. He said, when you become a fireman, and this is advice for all the young firefighters out there, don't ever need to have another job for finances. Like always live on your fire department salary.
That's good.
That way, if you don't have to work extra jobs, you don't have to work extra jobs.
Yeah.
Don't ever get to a point financially where you have to work overtime all the time, or you have to have a side job in order to just make ends meet. Live at the level of your salary, and you'll be fine. If you want to get an extra job to have, make some extra money for a vacation, go for it. But don't require that extra income in order to pay your bills. And that was good advice. That was good advice.
My grandfather said that he likened salary or income to a ladder. And it's like, if you think you can reach a certain rung with the income that you have, as far as what you can afford, aim a rung lower. Just live a rung below what you have. And
it's always
and I think you will be happy. I think contentment's a hard thing to learn.
Oh, for sure. Well, and happiness, contentment, that's really up to us. That's a choice.
Yeah, it is a choice.
Being happy, being content with what you have, that is really a choice. Don't, people get on social media and they look at all this other stuff. Don't judge your life off of that. So I think, to kind of wrap it up, I think remembering why you got into this field, is important. There's nothing wrong with wanting to make a good living. There's nothing wrong with that, But remember why you're doing it, why you're a nurse, why you're a doctor.
Well, that's what I was going to say, actually, earlier when you were talking about would you do it again? And I absolutely would, because I feel like it's my calling. It's my why. It's like as hard as some things were in training and sacrifice, I would definitely do it again because I think it was the right thing to do, and I felt called to it.
Yeah.
So that's, I think, if you're not called, or you don't feel really called to doing what you're doing,
go be an accountant. If you're not called
do
to be an
something
accountant, go be an accountant.
That's right.
People are going to be mad at you at tax time.
That's funny.
Well, it is a big topic. There's a lot of burnout in EMS. Again, especially since COVID, the call volumes, just everything has increased. The pressure has increased on EMS workers. So take care of yourself if you're a pre-hospital provider.
Oh, yeah.
Do your best to take care of yourself, take care of your family.
What we do is a big part of who we are, and it's a big part of our health and really our mental health. And if you're not happy at work or you're not happy at home, it's gonna touch every area of your life. So watch our Thrive podcast.
That's right.
That'll help.
Yeah, learn about all around health and wellness.
Absolutely.
So, yep. Well, thanks for watching. We'll see you on the next one.
Be safe out.
Thank you for listening to EMS, the Erik and Matt Show.